Today's date is March 25th, 1994. I'm Blake Haley, and we have with us Dr. Robert Adams, Chair of the Department of OB-GYN here at the University of North Texas Health Science Center at Fort Worth. We're making this video in the Biomedical Communications Department of the Gibson D. Lewis Health Science Library. And Dr. Adams, thanks for taking time out of your schedule to meet with us today. I'd like to start, if we could, about your prior experience long before you came to the Health Science Center, kind of a little background on you.
Okay, I'd be happy to. I started out, I'll start with medical school, and I went to medical school at the Kirksville College of Osteopathic Medicine. From there, did my internship in Jefferson City, Missouri, and subsequently did a residency in obstetrics and gynecology in Grand Rapids, Michigan. And after leaving Grand Rapids, I came here to the Texas College of Osteopathic Medicine in September of 1984. So I've been here almost 10 years, coming up this summer.
Oh.
And have been with the department first as an assistant professor, and have seen the department change quite a bit over those 10 years, as well as the institution.
What are some of the changes that you've seen come over the years?
Well, as far as our department specifically, we have grown considerably. When I came, there were 3 full-time faculty members, and the volume of patients was just around probably 300 or 400 deliveries a year, which is the major part of our health care, I guess, is in obstetrics. And so since that time, we now do upwards to about 900 deliveries a year. So it's considerably increased as far as patient volume. And then we also have 5 full-time faculty members. And we've developed a residency program here to where we are now approved to train 6 physicians in obstetrics and gynecology. So there's been a complete transition, I guess, as far as the department into the educational aspects and patient care altogether.
Now, you work also with the hospital across the street, correct?
Yes.
How has the relationship with that been over the years? Shall we say, joint situation?
Yeah, it's not been, I don't think, that unusual for most hospital medical schools that are non-related other than by proximity and profession. There are issues, there are good times, there are bad times. There are some politics involved, as with any hospital. But overall, I think that the relationship has grown, and I think that right now we're seeing a cooperative effort that is maybe as good as any time that I've been here.
I know you have a busy schedule, it sounds like to me, from what you've already stated. Do you, or have you been involved with much research over the years, or are you looking at getting into some other research aspects?
Our department really has not had a strong research effort. It's been one of the priorities that have been identified that we hope to establish. Through our residency program and through some clinical drug trials, we have had activities, but it's just not been to a level that we feel is probably appropriate for a clinical department at Health Science Center. As we've expanded our faculty, it allows us a little more time to look into those areas, and we hope that's what will also continue into the future. But up to now, I suppose the most significant activity we've done has been clinical drug trials and in medication usage in areas such as menopause and contraception.
Oh, so do you plan to do some more of that type of thing at a later date?
Well, we hope to. It kind of is according to availability. The companies come to us and ask for help, and of course we try to make ourselves available and known to companies to do those sorts of things. But it just depends on what's available and what's going on in the marketplace right at that time.
Why do you think that a health science center was necessary for the growth and success of TCOM?
Well, in the 10 years that I've been here, I've seen TCOM change tremendously as far as its role in the community and in the profession. I think that it has really gained a lot of respect in the community, and I think that the increased visibility and that respect have also had a real impact on the profession. Those things, I think, lead to growth in other areas, and I think it's been just a natural extension to look at a health science center, which allows us to train other areas of healthcare workers to utilize all the resources that have developed for the medical school. The medical school has gotten to a point that to use the resources only for the training physicians might be a little bit short-sighted. So, that's one aspect, is I think that there is a nucleus of people here who can just follow right over into the educational processes you'd see in other healthcare schools. The other aspect, of course, has to do with the benefits to the school, and I think that the school saw that as a natural direction to go because of the changes that we're seeing in healthcare funding as far as education. And as that funding is becoming more difficult to obtain, it makes sense to again try to put resources together to where you can offset costs by training multiple types of people and programs with the same trainers or educators, same faculty.
Mm-hmm. What are some other programs you'd like to see added that you think would be of benefit to the school?
I don't have a good perspective, I don't think, on what is involved in a lot of the other areas of ancillary programs. I think that as I look at healthcare in general, it would be appropriate to have a school maybe for nurse practitioners. I know that they've been talking about a public health school, and I think that there are other areas such as pharmacy schools and things that have been mentioned that could be explored, but I really don't have a basis of understanding to what the need is as with other schools in Texas.
Well, it brings up a question, then how do you see this school being different from the other health science centers in the state of Texas?
And I'm not sure that I can answer that with any real basis. Again, I'm not that familiar with the other health science centers. Definitely the one difference from the medical school itself is just the osteopathic background and the philosophy that is different in the teaching. Now, I suppose that osteopathic faculty then that would be involved in other programs would carry that philosophy, and perhaps it would give a unique perspective to any of those schools. But as far as other comparisons, I don't have a basis to really make a comment.
Also, a lot of people brought up the healthcare situation with possibilities of changing in the way healthcare is administered. Do you see as far as how the Health Science Center is positioning itself for changes in that respect?
I think that we're going to see tremendous differences in how medicine is practiced. I think that this health care center has perhaps a little bit of an edge in that we've already been so well disciplined in primary care, and that seems to be the way that medicine is going, so that hopefully we can, just as a direct extension of what we've already accomplished, proceed through the changes that are occurring and have a significant role in the healthcare in the coming years.
What challenges do you think lie ahead in the coming years for you and the Health Science Center?
I think the biggest challenges are going to be as far as for me personally and for our department personally, are going to be to establish ourselves as a provider of healthcare in whatever the new system is. I do think that the role of academic medicine is going to be redefined, and I'm not sure how that is going to really fit into the healthcare programs that are being described for the public as a whole. I think it's going to be much more difficult to attract or keep patient populations that are important for the educational aspects of our students and residents. And so I really look at that being one of our major areas of concern for the next few years.
Do you see your role changing significantly as chair of OB-GYN in the coming years?
Only in that I think that I'm going to have to place an increased emphasis on attracting, again, a patient population, making sure that we're part of the patient population to provide care. This may involve some contractual agreements and seeking out those agreements that we've not really had to do in the past.
We've covered a lot of ground here in a short amount of time. Are there some areas you'd like to bring up that I haven't touched on, and some topics you'd like to discuss?
In the 10 years that I've been here, I think the thing that has probably made the largest impact on me has been the changes I see osteopathic medicine in the community. I had come from Missouri and Iowa and Michigan prior to being here, and osteopathic medicine was well accepted in those areas, and I never had really been in an area where it wasn't well seated, I guess, in the medical community. When I came to Texas, it was a little bit of a shock because I found that you had this wonderful institution in the middle of the Metroplex, specifically here in Fort Worth, and I don't think that most of the people really knew it existed. I think that we've made a lot of strides at making ourselves known in the community. I think there's still a long ways to go, and I think that you know, the direction that the Health Science Center is going to be involved in community issues and programs is very important to succeeding in that. But that has also really given a lot of respect and identity to the osteopathic physician, who, again, up until some of those changes occurred, probably was not recognized for the impact that they could have in healthcare. And so I think that will hopefully continue, and we'll see that spread throughout the state to where, as we continue to have graduates, that they will go into areas of Texas and make the osteopathic profession better known as far as the medical needs that it can provide in primary care and preventive aspects, that sort of thing. I would like to see the hospital and the medical school continue to grow in their relationship. I think that there are many things that can be done collaboratively that will be advantages to both institutions, and I hope that the situations and the people involved and the politics can allow that sort of things to develop for everybody's best interest.
You said there's some things that you'd like to see them do collaboratively. Can you, off the top of your head, think of some of them?
Well, the hospital has many of the same interests that the medical school does, as far as the areas of primary care and rural health. Those areas are important to the survival of any hospital in today's care market. And so I think that where those areas intertwine with our areas of interest, it makes sense for us to work together in physician recruitment, in physician placement, in the care of patients. And then that also would help us tremendously in the area of education. Hospital has also taken a very strong interest in specialty training. And while we see that specialty training probably in the future is going to be a diminished area of emphasis in the future, I think that it still will play a role, an important role for us as osteopathic physicians to have a training program at a hospital such as this, you know, associated with it. And so their interest there, as well as our interest, will be, again, important in our future.
Do you think that there still needs to be some more community support formulated for the school?
Yes, I think that when we look at other medical schools and the level of community support, primarily through development plans and financial support for programs, for research, for scholarships. I think when you look at our institution, we can maybe see that we're still in the infancy in that regard. And I think that's something that we're seeing, again, in a more direct emphasis placed on in the last 2 or 3 years to hopefully we're going to see some fruition in the next few years and a lot more community support than what we've had.
Do you have some ideas in mind that you'd like to see done to help this out?
I really don't. I think that the plan that we have as far as developing some areas of academic excellence, such as the Geriatric Center and the Wound Healing Center, I think that those sorts of things are very, sometimes very easily promoted to the community. It's something that they can see, and it's a good way to get them involved in the school. And I think if they're involved, then the support becomes something that's a natural extension. So I would feel that that's a natural projection. I guess in my area of specific interest, one of the areas I've always had a kind of a special place for would be the establishment perhaps of a menopause unit or a menopause clinic where we deal with the needs specific to women who are having symptoms or disease processes associated with the menopause.
So that's one of the things you're interested in seeing develop?
Yes, that's one of the things that I've hoped that we could at some point develop, and I think it would probably fall into an extension of the geriatric center in this institution.
Is that what attracted you to TCOM back then, was the challenge of an up-and-coming medical school?
My interest in medical education is really what attracted me to a medical school in the first place. I was looking for job opportunities, and I really had always wanted to be involved in academic medicine, teaching to some extent. I had an opportunity to visit the campus here a couple of years prior to finishing my residency, and the institution facilities and the people here really were not like any that I had run into at other institutions. The facility here is really second to none probably in the country as far as osteopathic medical schools go. And it just looked like there was a tremendous potential here. It was obvious that there was still a lot of growth to occur, and that's really what attracted me to it. And there was a good opportunity in the Department of Obstetrics Gynecology. So.
Are there any other things you'd like to add that, real quick? Any other topics?
Haven't really thought of anything else that ahead of time. We covered
quite a bit.
Of them. Yeah, I don't know what else.
We covered quite a bit of ground. Well, Dr. Adams, I do appreciate you taking time out of your busy schedule. I know that we caught you when you were on call, I believe your assistant said, so I appreciate you taking time out to meet with us. And I know the school owes you a lot, and definitely you're an asset to the school and will continue to be, and we thank you again for your time.
Thank you.
And that will conclude this interview. Thank you.